Hello, it's a great opportunity for me to explain this lecture, inshallah. Our lecture today is about hemodialysis. Our objectives from this lecture are: first, perceive the process of hemodialysis and understand it well. Second, demonstrate types of vascular access used in hemodialysis and which one carry the most risk of infection and who's carrying the lowest risk of infection. Third, differentiated types of antiseptics, dressings, and use of each one. Fourth, understand the process of water treatment inside the hemodialysis unit, including the steps. Fifth, reduce the rate of infection inside the unit. Allah subhanahu wa ta'ala create one pair of two special organs inside our body. These organs named kidneys have great role in our bodies. Away from their endocrinal functions, which is very important, also their more important function represented by its ability to filtrate our blood from all waste products, toxins, unnecessary substances, excessive fluid, and excrete all of these substances in the form of urine outside the body. So let's imagine when this process stopped for any reason and the kidneys became incapable to continue their role or their function, what will be the result? You will see that all of these wastes will be accumulated in the blood, causing maybe, as we can say, life-threatening conditions. And in this case, we need management. One of these management that should be done is hemodialysis. So let's go to the definition of the dialysis. Dialysis or renal replacement therapies are procedures that replace the normal functions of the kidneys by removing metabolic waste products by diffusion, which is waste removal, or this is a process by which waste are removed from the blood, and ultrafiltration, and this is also the process related to excretion or release or getting rid of the excessive water from the blood through either through semi-permeable membrane. This semi-permeable membrane may be natural, as in peritoneal dialysis, and in this case this membrane will be the peritoneal membrane, or synthetic, as hemodialyzer used in the hemodialysis. Okay, so I have here three types of dialysis: hemodialysis, peritoneal dialysis, and CRRT, which stand for continuous renal replacement therapy. This one used for the persons or the patients who are dynamically unstable. They can't bear these two types of dialysis. So it's used in the ICU for the patient need dialysis. What is needed for hemodialysis? First of all, I need filter to filter the blood from all of this waste. Second, I need vascular accesses from the patient to the filter and vice versa. Also, I need a pump to push the blood from and to the patient, as well as I need here fluid. This fluid passes through this filter to allow the exchange process between the blood and this fluid, filtering the blood from all waste inside it. So, what about the dialyzer? As you see here, the dialyzer is called the artificial kidney. This dialyzer filters the blood what this dialyzer composed from? It's like a hollow plastic tube about foot long, around 30 or more centimeter long in length and 3 inches in diameter, containing many tiny filters. Dialyzers are made in different sides. There are 2 sections in the dialyzer from inside. Section for the dialysate, section for the dialysate and section for the blood. The 2 sections are divided by semi-permeable membrane so that they don't get mixed. Because it's semi-permeable, the membrane allows water and waste to pass through, but doesn't allow blood cell to pass through. Let's demonstrate here simply. We will take an horizontal section from the hemodialyzer. Here, let's imagine these are the tiny filters. This is a cross section, okay? Tiny filters inside the dialyzer. Here, passing the blood, okay? Here is the blood passing through these filters, okay? Inside these filters, okay? While the dialysate fluid, let's imagine it's purple here, passing between these filters, okay, as you see here, surrounding these filters. So the process of exchange will occur through what? Through this blue semi-permeable membrane, which line the filter. Here is the blood, and on the other side, the dialysate fluid, and here is the semi-permeable membrane of the filter through which the process of exchange occurs. Okay? Okay. Dialysate. What is the dialysate? Dialysate, also called dialysis fluid, dialysis solution, or both. This is a solution of pure water. This is both, not both. A solution of pure water, electrolytes, and salts, such as bicarb and sodium. So this is a combination of pure water or treated water or product water, as we will mention, in addition to some electrolytes needed for the purpose of waste exchange. The purpose here is to pull the toxins from the blood into the dialysate by diffusion. In the blood, the hemodialysis patient, in the blood of the hemodialysis patient, there is high concentration of waste, while the dialysate has low concentration of waste. So the waste will diffuse from the high concentration to the low concentration by process called diffusion. Due to the difference in concentration, the waste will move through semi-permeable membrane to create equal amounts on both sides. The dialysis solution is then flushed down the drain along with the waste. The electrolytes in the dialysis solution are also used to balance the electrolytes in patient's blood. The excessive fluid also from the blood is removed through a process called filtration. The fluid is pushed off by higher pressure on the blood side than on the dialysate side. This is the machine. Okay, hemodialysis is performed using a machine. What is this machine, or what is its function? The dialysis machine is like a big computer and a pump. It takes track of blood, keeps tracking the blood flow, blood pressure, and how much fluid is removed. Also other vital information. But there is an important point here. Blood never actually goes through the dialysis machine. The dialysis machine had internal fluid pathway here that makes what? Makes the produced water with the other components of the dialysate, which is bicarb and acetate. So this component passes through the dialysate pathway to the hemodialyzer. Here is the site in which the hemodialyzer is fixed, okay? And this is the dialyzer pathway that carrying the combination of the dialysate. Let's imagine let's use our pen. Let's imagine together. Here is the pipe. carrying the product water or the processed water from the water station. Here, let's imagine this is the water station, okay, and this is the water. Enter through the dialysis machine. The dialysis machine here has two sides for two containers. One container, sorry for bad drawing, I am bad drawer. This container carrying bicarb and the other container carrying acetate. Let's use another color. No, not red. Maybe brown. Here, all bicarb. Sorry, carb. And here is the acetate. Acetate. Okay, here all of these come here, and also acetate are mixing with the water coming from the water station, the produced water, making here the component of the dialysate. Then the dialysate passes through dialyzer busway, carrying this dialysate to the dialyzer here. Let's imagine this is the dialyzer. Okay. We will explain this also in detail. Here, the dialyzer. Here, the fluid passing from here out, from down upward, while the blood passing from up to down. While here is the, let's imagine here, this is the semi-permeable membrane. So there is no blood mix between the dialysate and the blood, only by diffusion. The waste was from the blood side to the dialysate side, and the needed materials from the dialysate side to the blood. Okay, here I have two major types or chains of this machine called Fresenius and Gump. Okay. Okay. Thank you. So the process of hemodialysis. Hemodialysis removes the toxins, electrolytes, and the fluids by circulating the patient blood through hemodialyzer. During the intermittent or chronic hemodialysis, the patients are usually scheduled to receive hemodialysis treatments for 2 to 4 hours, 3 times per week. The processed or highly purified water, also called product water, is needed to perform the hemodialysis. What about the dialysis process? We explained it and we will focus on it again. Here is the dialyzer, and from here the dialysis fluid pass from down upward, and this is the drain after carrying the waste removed from the blood to the dialysis side by diffusion, then passes through the drain to pass away. Here also the blood coming from the patient, here from up to down, then the filtered blood return back to the patient. This is simply the process of hemodialysis. As you see here, no blood is mixing inside the machine. Okay, this is only through the filter. Let's talk about the vascular access. We have many different vascular access. First of all, arteriovenous fistula, which is an implanted access created from patient's own blood vessels. Here there is an anastomosis connection or bridge between the artery and the vein. The wall of the artery sutured with the wall of the vein, creating a fistula. Arteriovenous graft may be something biological from the patient itself or something synthetic, as we will see. Other vascular devices can be used, which is called caster graft hybrid access devices, ports, and other vascular access. Also permanent central line, which is called tunneled cuffed caster, temporary central line, which is non-tunneled, non-cuffed caster. When to use this, we will mention. What carrying the highest risk of infection, as you see here, is the non-tunneled central line, which is also called temporary central line, then tunneled central line, then other vascular access device, as we mentioned here, the types, then the graft is in the last one, which carrying the lowest risk of infection is the fistula. Here is the shape of the fistula. Here, direct connection, as we said, artery with the vein, wall sutures together. While the graft maybe here is a synthetic type, carrying connection between artery and vein. What is permanent central line? It's called a tunnel central line, travels the distance under the skin and terminate close or close to the heart or one of the great vessels like superior vena cava. This is called a tunnel because travel a distance under the skin. When to select or what type of vascular access can be used? Selection and the maintenance of hemodialysis according to what? According to the risk of infection, according to the site will be used, according to the duration of the hemodialysis process needed. Okay, the risk of infection related to the circulatory access for hemodialysis vary with the type of vascular access used. Sure, so the risk according to the type of vascular access. There is 7-fold greater risk for bacteremia in patients with dialysis catheter than those with AV fistula. So the risk of infection with catheter is much more higher by 7-fold. Okay. National Kidney Foundation, which is called KADOKI, Kidney Dialysis Outcome Quality Initiative, and CDC recommend what? Recommend to use an AV fistula for the patient who need long-term dialysis because it carries the lowest risk of infection. Also, if it's not used, it will be substituted by AV graft. For acute hemodialysis, where the access for less than 3 weeks duration is anticipated, only 3 weeks or less, vascular access may be obtained using non-cupped or cupped catheter. However, if more than 3 weeks, here I need to use a tunneled or tunneled cupped venous catheter. These two organizations' guidelines state that the preferred insertion site is the right internal jugular for hemodialysis. When to use a subclavian access? Only when the jugular options are not available and in patients who are not anticipated to need permanent vascular access. Why we can use subclavian for hemodialysis? Because the risk of thrombosis and stenosis of this important vein is high in this patient. So what about the femoral catheter? Femoral catheter should be placed only in bed-bound patients, bedridden patients, only with good exit site care and should be left in place for no more than 5 days because the risk of infection in this area is too high. Antiseptics and the dressing types, because of its broad spectrum of activity, 2% chlorhexidine gluconate is the antiseptic of choice. Why? Because as we said, it's a broad spectrum covering many types of organisms. Applied for 2 to 3 minutes, allowing it to dry before cannulation. CDC states that the gauze dressing should be placed every 2 days and used when the wound is or the insertion site is oozing, while the transparent dressing is changed every 7 days and actually is the preferred one. CDC guideline indicates that the dressing should be replaced when it becomes damp, loosened, soiled, or when inspection of the site is necessary. If chlorhexidine can be used, what is the substitution? Is povidone iodine. All personnel involved in the maintenance of intravascular access should receive education on the appropriate measures of infection control and also periodically assist for their knowledge and adherence to the guidelines. Here is the picture for the dialysis water treatment station. Here is the reservoir tank of the potable water coming from the municipal water. Here is the filters, and this is the reverse osmosis, which is the main hero here of the process of water treatment. Then the water passes to the dialysis station. Water treatment for hemodialysis. Dialysis patients are exposed to 150 liters of dialysis solution each treatment. Providing clean water for dialysis is critical for patient safety and positive patient outcome. Should be noted that also potable water is not sterile, as all of us know that the potable water carrying high level of chlorine. This chlorine is removed during the process of water treatment. So the risk of bacterial growth will increase. So therefore, care must be taken at each step in water treatment to minimize the risk of introducing bacteria into the system and prevent the treated water from remaining stagnant. The component of water treatment need to be monitored closely to ensure optimal performance. Like what? We monitor the water hardness, we monitor the chlorine level, we monitor the endotoxin and bacterial level of the water. Here is also another form of the water station treatment or the water treatment station. Here is the tap water, different filters as you see, and reverse osmosis. And here is the tank carrying the product water or the processed water. Here. Let's go together to the component of the station. First of all, backflow preventer. This backflow preventer prevent the backflow if there is any system failure, prevent the backflow of treated water back to the municipal water. So I protect here the municipal water from the treating water to come and mix together. Okay. May be present and maybe not. Also temperature mixing valve. This temperature mixing valve mixes the cold and the hot water to reach the ideal water degree, which is 25 Celsius, which increases the effectiveness of reverse osmosis membrane. Let's come to the filters. First type of filters that we face after the tank or after the water reservoir is the particulate filter or sediment filter. From its name, sediment, so removes sediment and impurities from water that could damage or clog the water treatment system. The second type of filters is carbon filter. Carbon filter here remove the chlorine. This is begin with C and also carbon begin with C. Let's join them together. Carbon, chlorine. Remove chlorine, chloramine, and the other organic materials from the municipal water. Why? Because if the chlorine is left in the water, it will damage the reverse osmosis membrane as well as carrying water carrying high level of chlorine entering the blood of the patient during the diffusion process will cause hemolysis of the RBCs of the patient. Water softener, what does that mean? Just a minute, please, and I will return. So we came back. We was unmute myself. We were talking about water softener. Water softening containing something called resin or resin. This is represent like a sponge saturated with sodium and placed inside this softener. What is its function? This resin absorb the calcium and magnesium from the water. Let's imagine here. Here is the resin saturated with sodium. Okay. Just a minute, please. Carrying the sodium, and here is the water carrying the calcium with magnesium. So the process of exchange occurring here. between the water and this resin inside the softener. This resin release the sodium and absorb the calcium and magnesium. This process is called softening of the water. This process is important to protect the reverse osmosis membrane, which is the main hero of this process. Okay. Let's return. What is the reverse osmosis? Reverse osmosis uses the osmotic and the hydrostatic pressures over semi-permeable membrane. This is a semi-permeable membrane, and here we use the hydrostatic pressure over the semi-permeable membrane to remove the ions and organics. In this theory, reverse osmosis is capable of removing 90 to 99% of electrolytes and ore. Why it is called reverse osmosis? Because actually in the osmosis process, the water passes from low concentration to the highest concentration of solutes, which are the materials inside the solution. Okay, so in the process of osmosis, the water should pass from here to there. While in the reverse osmosis, the process is reversed from its name. The water as well as a solute passing from here to there. What about deionizer? Deionizer may be present, maybe not. Remove the ionic contaminants by exchanging the cations for hydrogens and anions for hydrogen peroxide, for OH. They exchange the hydrogen and the OH ions, then combine to become water. This deionizer doesn't remove the bacteria or endotoxin, and resin beds may contribute to substantial bacterial growth, may even increase the bacterial growth. So should be suspected if the processed water contain bacteria or endotoxin, as it may be the cause of this process. Ultraviolet light, as we said also, may or may not be present. Ultrafilters. These ultrafilters, with or without ultraviolet lights, used to remove the bacteria and endotoxins. Ultrafilter should be the last component of the water processing system before the distribution loop. Here is the reservoir for potable water. And these types of filter, as we mentioned, you can see that softener may be the last one, or the carbon may be like this, or maybe there is exchange between the carbon and softener. Here is the resin containing the sodium, or sorry, here is the reservoir for sodium that used to saturate the resin inside this filter. This is a reverse osmosis, and this is the tank for the product water, and this is a pump to pass it through the ultraviolet. Another type of station, the same component as you see, but here you will see there is ultrafilter for bacteria and endotoxin after the tank of potable treated water. Water treatment unit, as we see here, is a filter, okay, then the reverse osmosis, then the ultraviolet endotoxin filter, then the pump, then the distribution loop to reach the machines. The blue color represents the machine. This is a vital or a video from a real station. Let's see together. Here is the tank. This is a sediment filter, carbon filter, and beside the black container is the softener containing the sodium. Then the RO, reverse osmosis membrane, which remove 90 to 99% of bacteria and endotoxin. Then the tank containing the treated water or the product water. This is the pump that pumps the water through these ultrafilters. Then ultraviolet lights. Then there will come the endotoxin filters and bacteria. Okay. So dialysis-associated infections. We have different types of dialysis-associated infection. Here, access site infection, bacteremia, peritonitis, and bloodborne pathogen. Here, access site leading to bacteremia. Peritoneal dialysis may lead to peritonitis and the bloodborne pathogen and the hemodialysis. So, an infection prevention as an IB or infection preventionist, I should be familiar with the recommendation to reduce the risk of access-associated infection. Hemodialysis water processing and distribution system, medication safety, the basic concepts of hemodialyzer reuse and the reuse program in their own facility. Prevention of bloodborne pathogen transmission in the dialysis station. Risk of infection or adverse reactions in the dialysis unit can be reduced by what? By these following measurements and precautions. Firstly, strict adherence to aseptic technique during all dialysis procedures. Strict adherence to procedures for use, disinfection, and maintenance of equipment used inside the unit. Knowledgeable, well-trained staff applying and monitoring evidence-based practices. Careful monitoring of all processes in which bacterial or chemical contamination can occur. Effective patient education programs. This is vital, including teaching the patients, their families, their role in prevention of dialysis-associated complication, including health maintenance oriented with infection signs and symptoms. Routine monitoring and follow-up of patients undergoing dialysis, including an active infection surveillance and prevention program. Strategies for reducing the infection risk associated with hemodialysis, including CDC precautions. Use the standard precautions and the gloves. Wash and sanitize the hand between each patient. Items are single-used, if applicable, or cleaned and disinfectant prior to returning to the central area for use on another patient. Use single-dose medication or multi-dose vials for one patient and don't return to the central area. Conversely, prepare the medication from the multi-dose vial in the central area and deliver separately. Don't use common medication card for multiple patients. Clean and disinfect the entire station, including the furniture and the equipment between the patients. Vaccinate a susceptible patient for hepatitis B virus and establish routine testing protocol for hepatitis B and hepatitis C virus. Time for active discussion. Strategies to prevent. Let's begin with the first question. What are the strategies to prevent the infection of dialysis access site, including the following? These are the options. First option, utilize the AV graft if fistula can't be established. This is true. Use a tunneled cuffed catheter for acute dialysis if used maybe more than 3 weeks. This is also true. Subclavian access is preferred over jugular option. It's not true. As we said, the jugular, especially the right jugular one, is the preferred for this process or this hemodialysis. Number 4, use the femoral catheter only in bed-bound patient for no more than 5 days. Number 4 is also true. So we will exclude the option number 3. So our answer will be B. Second question, unused alcohol swabs that are placed on top of the dialysis machine in an active dialysis unit. Let's see that alcohol swabs is considered as single-use item. So once this single-use go to the patient care area, it must be discarded, not should, must be discarded. Maybe return as option B, maybe return to the common area. No. Must be cleaned? No. Should only be used on patient with that dialysis machine? No. Should be discarded. So the answer is A. Number 3 question. Culture of patient dialysis access site grow gram-positive. Notes. Cocci. One of the factors contributing to this type of infection is contamination of the water used in dialysis or skin colonization with Staph aureus at the access site, contamination of the antiseptics used to prepare the access site, seeding the access site by remote site of infection. Here's the key word here is the gram-positive cocci. Here referring to the Staphylococcus organisms that is represent the major colonizer of the human skin. So our answer will be B. The source of this organism will be skin colonization by this organism at the axis side. Number 4 question. لازم ننزل تمرين. Dialysis patient has recently tested positive for hepatitis B antigen, but previous notes was negative. The manager is concerned that the patient may have been exposed during a treatment. Which of the following is the most likely explanation of the patient positive result? Here, the patient before was negative, and by testing the patient again was S antigen. Here, I should take in consideration if the patient here is vaccinated or not. Why? Because after, if you do hepatitis B antigen test after within 7 to 30 days of the vaccination, in this time period, it will give you positive result. This does not indicate infection, but this is from the vaccine itself. And this confirms our answer because the patient previously was negative. So the answer will be, let's read the choice together. The patient is resolving an acute hepatitis B infection. No, the patient received dose of hepatitis B vaccine in the last 21 days. So it's more logical answer. The result indicates that the patient has chronic infection. No, the patient is immune. No. So our answer will be B. Patient with positive hepatitis B antigen must be patient with positive hepatitis B antigen must be dialyzed. Which of the following are the best measure to prevent the transmission? Here I have patient hepatitis B positive. So what will I do? Perform the treatment in a separate room or area. Use dedicated machine and equipment. Both these answers are right. Perform treatment at the end of the day. Why? Schedule the treatment on a separate day with the other positive hepatitis B antigen patient. Why? It's not related or it's not needed. So I need separate area or separate room with dedicated machine. So my answer will be C, option 1 and 2 only. Thank you very much. Hoping get benefit inshallah from this lecture. Goodbye for you all.